So you've reached your weight loss goal. Now what? That's what we're going to talk about today. Hello and welcome to my channel. My name is Dr. Megan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you're in the right place. Today's topic is based on a question that I get asked a lot, and I'm just going to read a couple of the versions of this and then we'll dive right in. So one person wrote in, can you discuss how to transition off of the Wegovy once goals are met and or insurance ends coverage? Somebody else wrote in, I'm interested in hearing about how to come off these meds successfully after hitting weight goals or the threshold where insurance no longer pays for them, which is 30 or 27 BMI, depending on you having one comorbidity. My goal weight puts me at a 23 BMI, so I would still have more to lose. There needs to be more focus on long-term management after GLP-1s. Another person wrote in, will you be doing a segment on managing GLP-1s after you reach your weight loss goals? Do you think that simply stopping is better than titrating down? And how do you know if you're a candidate for long-term maintenance doses versus stopping the medication? So I get this question a lot, so I'm gonna dive into it now, but if you have more questions afterwards, please leave them on the video and I'll do a part 2. So you reached your weight loss goal. Now what do? The answer is simple. You keep everything exactly the same. Don't change anything. If it's working, keep doing it. So if it's working, as of, winter, spring 2025 at the filming of this video, we do not yet have a protocol for people titrating down, stretching out the doses, going down on the doses. We don't have that yet. And we do know that these medications are dose dependent. So the higher up you go, the more weight you're going to lose. So in general, if I have somebody who they've reached their goal BMI, they're on tirzepatide, 15 milligrams, they reach that goal, they're going to stay at 15 milligrams. I'm not going to titrate them down. It's working. That's where I'm going to keep them. Like, that's it. Also, insurance should still continue to cover. So and I can't speak I have given up guessing what insurance is going to do. But in general, they don't cut people off once they are successful. It's similar to how, if somebody's getting their blood pressure medication covered, once your blood pressure is controlled, insurance doesn't stop paying for it because it's under control. Like, the goal has been achieved, so they usually continue paying for it. For people if they have a BMI. The insurance really wants to know that it's making a difference. They don't usually stop people because they've succeeded, right? What they're really interested, what they don't want is for people to be on these medications and they're not losing weight. They really don't want that. And that's why they can be very picky about percentage of weight loss achieved, and why sometimes they're very picky on the prior authorizations, because they really want to make sure that they're not paying for these very expensive medications and somebody isn't getting an effect. They are not stopping coverage because somebody got to a BMI of 23 or 24. That's not something that I'm seeing at all. That being said, sometimes insurances just stop covering them overall, or they say, oh, you know what, this year we're just not covering weight medications. Like, that could still happen for sure. That's not really what we're talking about today. And you definitely want to have a backup plan with your prescribing physician in case that does happen for you. But in general, insurance companies are not cutting people off because they succeeded and got to a lower BMI. Also, if you've gotten to your goal weight or your goal BMI, don't stop the lifestyle changes. Keep everything the same or keep evolving it, right? This idea of like the weight loss is finished is not a helpful idea to have in your brain in terms of long-term success. We are always you want to have a growth mindset for this. We're always growing, evolving, changing, reaching towards the healthiest version of ourselves that will ultimately we'll never fully achieve, right? But then we're always moving towards it. There's always things that we can be doing and changing to get to that healthiest version of ourselves. We're never done. And I think this idea of like, I'm done, I fixed it, is really not helpful for weight loss, because people might think they can go off the medications, which we know when in general, when people go off of the medications, their weight does tend to creep back on over time. And then also they stop the lifestyle changes. And these are all the things that got them to the goal to begin with. So essentially, whatever you're doing, whatever control you, if in it, whatever capacity you have in terms of control over it, in terms of you can still take the medication, you can still make the lifestyle changes, just keep doing it. And that's why it's really so important that when we're making these changes, we want to be making sustainable changes, because it's not like, well, I'm done. It's like, no, you have to keep doing this forever. So you really want to make changes that you don't mind doing forever, and that ideally help you feel better. So it's like a win-win. You're feeling better, you're healthier, and you want to keep doing those things forever, as opposed to just reaching a milestone and then stopping, because that's a recipe to be very disappointed. So anyway, the short answer to this question is, once you've reached your weight goal, just keep doing what you're doing. If you're worried about overshooting the mark, definitely talk to your prescribing physician. In these cases, sometimes people may want to dial it back a little bit, but in general, once somebody's reached their new normal on their weight medication, I just keep them there and then continue all the lifestyle changes, and then keep thinking about other ways that you want to evolve into your healthiest self. So thank you so much for an excellent question today. That's going to do it for today. Thank you so much for watching. If you have questions afterwards, please leave them on the video down below and I'll add them to the list. If you want to work with me directly, if you're confused about your weight, if you are confused about why you're overeating, if you're confused about why you can't get yourself to exercise, you should schedule a consult with me, because I do work with people around the world as a life coach to help with the non-medical aspects of weight loss as well. So I'll leave all that information down below. Thank you so much for watching, and please be well.